Now, for the next nonsteroidal anti-inflammatory drug, which we'll be looking at, this is what is known as aceclofenac. Aceclofenac. Okay. So for the aceclofenac, I have all the pictures here, right? Don't need to worry much. So it's a nonsteroidal anti-inflammatory drug, okay, all right, and it belongs to the group or family or subcategory which is known as what? The phenylacetic derivatives. So have diclofenac there too, okay. So the phenylacetic acid derivatives, they kind of like end with phenac, okay. So it's structurally related to diclofenac. You see it, they included it here too. So how does the drug work? The drug works by blocking two enzymes that are very important for the production of prostaglandin, which will in turn make your body to generate pain and inflammation. So this is cyclooxygenase enzyme 1 and cyclooxygenase enzyme 2. So if you block the cyclooxygenase enzyme 1 and 2, of course we are reducing the amount of prostaglandin that will be produced, okay. So it's also shown to inhibit what? Neutrophil adhesion and accumulate at sites of inflammation, okay. So it will now what? Provide anti-inflammatory effects, pain relieving effects, reduction of fever effects, okay. That's antipyretic effects. So what's the pharmacokinetics? Absorption, usually give it through the oral route, and absorption is rapid. Distribution is highly protein bound, about 90%. Metabolism is in the liver, okay. Then to be converted to its active part, which is known as what? The diclofenac, okay. So elimination half-life is about 4 to 5 hours. Excretion is mainly through the kidneys, okay. So what's the therapeutic use? It's used in treating osteoarthritis, that's joint inflammations, so to relieve the pain and to reduce the stiffness that patients experience with that. It's also used in rheumatoid arthritis, which will reduce the inflammation and joint pain, okay. Then also used in treating what? Ankylosing spondylitis, okay. That one too, to reduce the inflammation, also reduce the pain. So adverse effects is GI upset. You see that generally they have, I told you guys that pharmacology of nonsteroidal anti-inflammatory drugs is very simple. They have the same pattern. So most of them, their differences come in the different disease conditions they are used on, okay. That's why it's still good to always discuss them individually. So they can cause nausea, dyspepsia, they can cause headache, they can cause dizziness, okay. Now if they disturb your stomach too much, sometimes they can make you to bleed, okay, cause some ulcerations which could lead to bleedings.